It's 7:14. Most people think seasonal allergies and they think springtime. However, seasonal allergies can also affect you in the fall. Dr. Anne Carrere from Touro joins us now with some tips for how you manage that. Dr. Carrere, good morning to you. What exactly triggers fall allergies?
Yeah, good morning. So first I'll start with what exactly allergies are. And allergies are an inflammatory or immune response to an antigen or a foreign particle such as pollen, dust mites, etc. Specifically in the fall, the triggers can be for the outdoor pollen type allergies. Ragweed is the antigen that tends to cause that inflammatory reaction, the sneezing, the coughing, the runny eyes, etc. And so ragweed can travel for miles in the air, especially in the dry or fall air. It also has some cross-allergen reactivity to certain fruits and vegetables like bananas, melons, zucchini. Mold also is a common allergy that can be year-round, but especially in New Orleans where it's humid in the fall, can exacerbate in the fall. And then lastly, dust mites.
Okay, so before somebody has to come see a doctor, what's the best way to treat this? Or is there any one standard rule?
Sure. So yes, there are many over-the-counter treatments for allergies and home treatments. So we've got our topical, our nasal sprays, nasal steroids, nasal antihistamines. Some of those need prescriptions. You've got your oral antihistamines, both your drowsy and your non-drowsy. These are typical over-the-counter medications that you see in your pharmacy. And so these can help for more symptom control. So the antihistamines and the nasal sprays are ideas to help decrease the reaction. But if decongestants are another option that help with sort of that fullness that people get, that nasal congestion. These, however, you want to be cautious about, especially if you have things like high blood pressure, cardiac conditions, and then if your allergies persist for a long time, they're every year, you're just really suffering, you can meet with an allergist and once you determine what actually your allergy is, they can do immune therapy. So
And I guess also it's really important to kind of understand what you are feeling so you don't take the wrong stuff.
Oh, certainly.
You could dry yourself out too much, for example.
Exactly. It's always wise to, talk with the doctor and determine that, in fact, you do have allergies as opposed to a cold, but allergies are something that people seem to persist over time. So, people that have allergies sort of know.
Finally, is it kind of important to, and that's the thing, a lot of people with allergies unfortunately have had, some training. So
Yeah.
They may know that it's kind of important to kind of catch this at the first sign of that little drip, before you have to wind up resorting to a doctor's visit.
Exactly. Allergies can tend to be, just you get the runny nose, the itchy eyes, but sometimes, it can turn into a sinus infection or it can cause bronchitis in certain patients, especially if you have asthma or other lung conditions. Yes, sir.
All right. Well, Dr. Anne Carrere, we appreciate the advice. Maybe you'll spare somebody a little bit of suffering.
Yes, hopefully. Yes, sir. Thank you so much.